Hello everyone. I am an international medical graduate in Canada and I am currently exploring my pathways to residency and I am currently taking my licensing exams. So I just wanted to give a brief overview of the whole process. If you want to practice medicine in Canada, there are some basic requirements. Number one, and the most important, is that you need to be a permanent resident of Canada or you need to be a citizen of Canada, for which you can apply through Express Entry program or the Provincial Nominee program. I will discuss the immigration process in another video. So the next step is that you have to take some licensing exams. Most important are MCCQE1 and NACOSCI exams. These exams can be taken without permanent residency or citizenship. You can take these exams while your immigration process is in progress. So for the MCCQE1 is MCQ based exam, written exam. It has two portions, MCQs and the CDN. So the fee for the MCCQE1 is $1,375, and it is very similar to step 2 USMLE. There are some practice tests available on MCC website which are highly recommended because the actual exam is very similar to the MCC practice test. So the other exam is the NACOSCI. Its fee is $3,050, and this is an in-person exam where you have to take history, perform examination, or do some counseling. So basically these are the two exams. Then recency is not a requirement to apply, but you need to show clinical experience within the previous years. And there are some IMG friendly provinces where you can also show 1 year of independent practice experience within the previous 5 months to apply. In addition to that, there are some other tests like IELTS and OET for language, and there's also a Casper test, which is a situational judgment test to assess your personality and how you behave in different circumstances. So these are the basic requirements. Then moving on, if you are an IMG in Canada, then there are few pathways that you can choose to land in residency in Canada. There are some of the provinces that have a 2-year program for IMGs in the medical school. So after graduating from these two programs, you can apply in CAMS as a Canadian medical graduate. That is a big benefit. So these two programs are available in the provinces of Nova Scotia and Quebec. And the basic requirement for these is MCCQE1 exam, and the other is that you need to be a citizen of these provinces and you need to be a permanent resident of Canada. So the main residency matching program is CAMS. This is for recent graduates or with graduates with no previous clinical experience. And this is a centralized application. It has a centralized application through which you can apply to all provinces. Then for specialists, there are special practice ready assessment programs, the requirement for which is specific to every province, and they require up to 3 years of experience, independent practice experience, and the basic exams like MCCQE1, NACOSCI. But the requirements are a little bit different for each of the specific program, which you can find on their specific websites. So there are also MLP-IMG. This is a program for Manitoba, for IMGs in Manitoba, and this is a program that requires you to take a NACOSCI exam, and it requires 1 year of independent practice within the previous 5 years to apply. And of course, you need to be a resident of Manitoba. So these are the main pathway that an IMG can take in Canada. So there are some provinces that are very IMG friendly, like Manitoba, Saskatchewan, British Columbia, Nova Scotia. and some specialties are very IMD friendly, like family medicine and internal medicine. So these are the roles that can strengthen your CV, and you can show these roles in your CV by teaching, by volunteering, and by participating in research activities. So first, an important but a minor but an important step is that you need to check whether your medical school is present in World Directory of Medical Schools. If it is present, then we are good to go. Then you need to make an account on physiciansapply.ca. Fee for that account is $310. All this is in Canadian dollars. Then you need to verify your documents through physiciansapply.ca. Mainly you need to verify your medical degree. Only after the verification of your degree you can apply for the exams. Then you need to take MCCQE1 and NAC-OSCE exam, some other exams like CASPER, IELTS, and then you will apply for residency and hope for the best. So these are some of the important websites that you can visit for further detailed information. And yes, I hope the video was helpful for you. Thank you.